Thank you everyone for joining us today. So my name is Samara and today I am here with these wonderful group of women to talk about health and wellness, which is a very important topic within our community here, especially in the Southeast region. So you'll have everyone's bio and information so you know who they are, but this is a really great conversation. So I just want to dive right into it. So I want to start with Dr. Agostinelli here as the physician on the panel. When you're looking at the community here, what are some of the biggest ailments or issues that are facing Hispanics within our population, our community in the Southeast and specifically here in Miami-Dade?
Good afternoon, everybody. I think we can briefly touch upon access to healthcare, right? Can these patients afford insurance? Do they have employment that allows them to? What's their economic status? What's their income? And when we look at those things, if they have health insurance, but they can't afford the care or they don't have access at all, obviously it limits their ability to have access to preventive measures, preventive care. And so by saying these things, what are the most common things that we see? Obesity, diabetes, hypertension. If we can't touch them ahead of time and give them the tools they need to improve on their diet, exercise, the family as a whole, the nucleus, this all trickles down. Earlier, they touched upon that the youngest, 11, Hispanic. We can teach mom and dad how to eat healthy and how to integrate that into their family unit. Then we have 11-year-olds that grow up to be healthy as well. You know, if they don't have access to their medications, how are their diabetes going to be controlled? And then what happens long-term? Complications. So disease burden increases, obviously cost goes up as well. And these are things that, you know, I see in the practice daily. So it's very important to take that into consideration.
Emma, I'd love to hear your perspective on this as well. I know you have some additional information in regards to what are the barriers that we're seeing and specific data within the region.
Yeah, so specific to Miami-Dade, which is 70% Hispanic, as we've seen nearly, there's major issues in terms of access to care. So first, Miami-Dade has very low rates of insured adults, so high insurance rates, and also low rates of adults who have access to a usual source of care. And that's despite having quite a few or a higher ratio of primary care physicians who are practicing in Miami-Dade. But then you also touched upon there's things happening outside of the healthcare system that also affect health, so social, economic determinants of health. And you do see some pretty large disparities specific to Miami-Dade and the Hispanic community in particular. So one is there's a major housing crisis here in Miami-Dade. I think we're all familiar if you're local. Higher rates of violent crime. And one area in which Miami-Dade really sticks out is actually social isolation, has some of the lowest or highest rates in the state. And that's really important because social isolation can have as much of an effect on your healthcare status as smoking, right? So it can have very major effects on life expectancy, quality of life. Also, Miami-Dade has very high HIV, AIDS, and syphilis rates. And that is not just existing infections, but also high rates of new infections. And that requires an integrated response between both the healthcare system itself, but also other community things outside of the healthcare system that, you know, can lead to lower rates of HIV.
And just to touch upon again, since we were talking about the mode age here in Miami or in the Southeast region of Hispanics being 11, Karina, I'd love your take with your work with Amigos and Kids, what you're seeing as some of the largest challenges as well.
Well, as Emma mentioned, we have a huge housing crisis here in Miami-Dade County. And, you know, in thinking about social determinants of health, we know that where you live has a huge impact on your health. Your zip code has a huge impact on your health. So what we're seeing with families is, you know, a lot of immigrant families, because of this economic crisis and housing crisis, they settle into low-income neighborhoods, which typically have less access to healthy foods, less access to parks and places where people can be physically active. The streets are not friendly for bicycling. So all those things affect access to health, access to healthy foods. So what we're seeing with our families also is because they work in low wage and very schedule unstable types of jobs. And they don't have access to health insurance or employer sponsored health insurance. We see a lot of families, immigrant families that have immigration issues. And so they're not eligible or don't qualify for government programs that help with healthcare. So those are some of the main issues that we're seeing with our families at Amigos.
Thank you. So these are some of the biggest challenges that we're facing here. And what I would like to talk about next is how can we actually combat these? So Barbara, I'd love to turn it to you in specific with your work and what you've seen within your area. What are some things that you think that would help to combat these barriers and get over them?
Sure, thank you. Good afternoon, everyone. So the call to action. This is a new endeavor for our nonprofit in South Florida, and it is what is going on in our community. How do we bridge what is the current status of our community members and access to those medical facilities? So we've learned that health literacy is vital. It's not just putting information out there, it's ensuring that that information is literally communicated to our constituents, but that the key is the understanding of that information. Also combining the new health digital transformation. This has also been vital just to get a simple access to a test to enroll. Everything has been digitalized, and finding that gap within the service and delivering that service to our community members is most important for us.
Sandra, as someone who works regularly with community engagement, I would also love to get your take on this.
Thank you. So yes, what we have learned in Cano as how do we take all of these great components that my partners here are saying, and how do we put it into action? So we serve more than 250,000 members nationwide. Just here in South Florida, about more than 100,000. And we see the spectrum from pediatrics all the way up to 80, 85 to 90-year-old members. So what do we do with them? How do we keep them educated within an environment of that they feel safe? So within our centers, we have what we call our wellness centers. And what we have built is that safe environment that you were talking about, that they can come in, they can have the nutritional classes, they can have their Zumba, they can have their socialization, goes back to the isolation that we see in our rates. And it's kind of like wondering, how can we expand that, not just here in Florida, nationwide, and not only with what we're doing in Cano, but all the other companies out there. This is what they should be looking at right now, spreading the same message, or spreading the same model, because the same needs that we have here, we have everywhere else.
So we had mentioned when Claudia was up here that we are at times fragmented, and we sometimes tend to go into, you know, the Colombianos over here, the Brazilians over there, and we really need to work to unify and bring each other together so that we can better combat these. And so one of the things is looking at other communities who have successfully come together and rallied and been able to bring their community forward. So in looking at, you know, what examples might guide us into these areas that would benefit us. Dr. Agostinelli, I'd love to hear from you. What are some good examples of frameworks, perhaps, and just North Stars that we might be able to look at to be able to implement here?
So one of the things that, as a physician, it's important to understand the culture. Sometimes we think that Hispanic is one culture, and as Claudia stated, it is not. There are many different cultures, many different ways of saying the same thing. And as a physician, it's important, and it's my job to understand what that language is. When the patient is able to communicate with me and I understand them and they feel heard, then we decrease that fragmentation, right? I'm Cuban descent, first generation Cuban American. Don't be fooled by my last name. It belongs to my husband. And so when it comes to that, I also have to learn different cultures, right? A Colombian may speak a different way than the Mexican. And so that's the way that I try to help with fragmentation. I try to learn about their cultures, bring that together so that I can provide them the care that they need in an environment where they can feel that they can communicate effectively and be heard. Because the Hispanics need to be heard. And I don't feel that they're being heard in a way that makes them feel respected and valued. And we need to be respected and valued. So these are very important things in my line of work.
I'll open it to anyone else who would like to add to what are some examples of, different kind of North Stars that we might be able to look at as models for us to implement here.
Sure. Community engagement and community outreach. We cannot expect for people to come to us. We need to be the foot in the ground. We need to be the voices for our community members, and we need to assess what is really going on in their day-to-days. Community needs assessments, surveys are great tools, but don't just have a survey and a list of questions and get responses. Engage in conversations. During conversations, we will get the actual day-to-day experience and challenges that our community members are facing. And that's the best approach to be able to have targeted marketing that was noted earlier today, targeted services, targeted accessibility to services.
There's a growing body of research that supports the use of community health workers, or in Spanish, promotores de salud. And I think that community health workers play a vital role in allowing the Latino community to access healthcare because they are from the communities that they serve. They're trusted members of the community. They know all the resources available, and they're able to help Latinos, regardless of their cultural background or where they come from, navigate a very complex healthcare system and different benefits that they might be able to access. So supporting nonprofits that do that boots on the ground work and use promotores de salud is going to be helpful in allowing Latinos to have access to healthcare.
If I can just add, I think that also when you say the North Star, the first thing that comes to mind is owning being a Latino. I think that we all have great resources in the community. We have great non-for-profits. We have great associations. But sometimes I feel that we don't own it enough. And that means that we don't share that with the community enough. And we don't help the Latino community get to those resources. So saying, yes, I'm Latina, I'm Cubana, whatever, that makes a huge impact. And when you're sitting on the table, especially when you have power in some tables of negotiations, of building or supporting an association or building a non-for-profit, that is key. And having that voice, I think is key.
And I think just to add in terms of some of the policy type solutions, one of the things that I know the Florida Department of Health has struggled with reducing the new HIV infections is that one targeted intervention won't work for every group of people, even within the Hispanic community, right? So not just looking at the Hispanic community as a whole, but taking into account some of the differences in communities, even within Miami-Dade County itself, is really key. So what they found work best is even small neighborhood interventions that really, they know the people working there, they're part of the community itself, and they can really understand the barriers that lie there.
We talked a lot about, I think, physical health, which obviously is usually the forefront of what we are thinking about when we think of health and wellness. One of the things that struck me is when, Barbara mentioned this isolation, right? And folks who are isolating. And what does that actually mean when it comes to your health? Here, we aren't necessarily, of course, it contributes your physical health, but mental health. And, I think that within the Hispanic community, there is a stigma. We've come a very long way, I will say, but mental health and talking about it and access to mental health services has really been at the forefront. I think over the past 2-3 years, especially, everyone in this room at some point, I think, will have at least thought about what that mental health means to you. So when we're looking at our communities that are at most risk here in the region, when it comes to mental health, what are some things that you have seen that really have made a difference in the population that you're working with specifically?
I have a very large senior population. And one of the things that occurs is that they leave their country where they have a front porch and they sit outside and they can talk with all their neighbors. They get uprooted and placed in neighborhoods where they don't have that front porch anymore. They don't have access to that person passing by and saying, Buenas tardes, ¿cómo está? But guess what? They're home alone the majority of the day because their family works or their grandkids are at school. And so one of the great services that we have are activity centers. She had touched upon that. I've had patients that are very sad. They sit at home alone. They even look at their old pictures and reminisce of what it was like when they were in their country. And so by them having access to this, first of all, we offer that transportation. We pick up that patient, we take them over there, they make new friends, they play dominoes, they play bingos, we have arts and crafts, Zumba. And so it gives us a sense of community now. And they're also with other people, other Hispanics that have been down that road, or simply, they're just all hanging out, trading recipes, talking about their doctor that's upstairs and how good she is. That's me. And so these are great things. And let me tell you, I had a patient, she would come every visit and she would cry. And the stigma, you'd be amazed at how many people will tell you, no, doctora, yo no estoy loca. And to break that, for me to teach them, it's not about that. It's about you being happy. And I always tell them, everyone deserves to be happy. And happiness is different for everyone, right? I had her go to the activity center. Next visit, she was very happy because now she had someone, she had a purpose, she had friends, she had things to do that didn't involve being trapped, and reminding herself that for her, things were better where she was. And so obviously this helped her mental health immensely. And I didn't have to give a medication. It's taking the time. Once again, getting to know that person that's sitting in front of you and making that connection. And so that's just one great thing that we have that we can offer our patients.
I love that. I think I've certainly heard that. I feel like we may have heard that, going to therapy, that's for crazy people, It's like, well, after the past 2 years, I think we're all a little bit there. So I think it's so important that we make sure that we include this in our conversation, because there is such a big stigma. And that is one of the first barriers. I think, your mind, if you can go over that, then you'll be much more apt to get services and just live a healthier lifestyle in general, right? Would anybody else like to add to the conversation here?
I would just like to say that during the pandemic, we saw a lot of the families that we serve were very isolated. And on top of being isolated, we're dealing with grief issues, lost family members, lost jobs. And so for us, and just kind of piggybacking on what Barbara said earlier, starting those conversations, building community with other families that we serve, even if it was virtual, was really helpful in opening up the conversation about seeking mental health treatment, and that it's not a weakness, because a lot of our families saw it as a weakness because of the stigma around mental health in Latino communities. And so again, doing that boots on the ground work and working with promotores de salud and community health workers is really helpful, because they're trusted members of the community that accept what is being, the education and, information that is being delivered.
So if I can just share a quick story. During the pandemic, our members, they were so used coming to our wellness centers, activity centers, because that's their place to be. They love going there more than going to see their doctors, right? That's where their friends are at. That's where they have all their activities going on. But during the pandemic, we never closed our centers, the medical portion of it, but we had to close the wellness, obviously, because we didn't want to have a lot of people coming into our centers. So we said, okay, let's be creative, because if we leave our seniors to be alone for this whole time and all they hear about is COVID, they're gonna go back to going deep into their mental health issues and isolation. So the health and wellness department really sat down together and they put together this phenomenal program, and we did an over the phone wellness classes. We did Zumba over the phone. Don't ask me how, but we did it. We did shared yoga over the phone. We did concerts, we had open conversations. They would talk to each other, and we would have to actually leave the lines open for a few minutes because it'll be like, Fulanita, how are you? You know, so, but those hours that they spend every day just listening to someone on the phone, other than just COVID, made a huge impact, huge impact. So just having those creative things to maintain our population healthy and to keep them active, I think it makes a huge difference.
And
Emma?
just one other thing to touch on the stigma aspect. We see that men in general have lower reported rates of depression, but higher rates of suicide and other severe outcomes. So one thing in particular, depression can present differently in men. Often it can come off more as aggression than what we would typically think of. And so some understanding of that in the community is also very, very important.
Go ahead. For us, it's creating a sense of belonging, right? We're here because of our clients, because of our participants, and acknowledging that, and a simple thank you, right? The thank you would just paralyze our clients. They're like, why are you thanking us? We should be thanking you. And I was like, we are here because of you. We're here to serve you. We're here to learn from you. And the pandemic was a game changer for all of us because we all went through it together. We had losses, we had grief, we had isolation. So we went through it together simultaneously. And that actually shifted the rapport that we had with our clients. So that was a new beginning for us.
So we talked about some of the things that we've seen within the community and the direction that we should go. And it's all about energy and effort and where we're putting our resources and allocating our time. So for anyone on the panel, are there things that you're seeing that just isn't working and that we should stop doing within our community in order to make room and make space for the things that we talked about today?
I think the most important thing is us going to them. I think we need to stop with the mentality that they need to come to us. This is so important. We have Hispanics that live in rural communities. They may not have the transportation. They may not even have the knowledge on how to get to us. And if we continue to expect as physicians that they're going to have to come to us so that we can treat them, it's not going to work. We're here to help them, to make them healthy. And if we take that moment doing outreaches, right? We go out to the rural communities and we check blood pressures and we do spot checks, make sure that everything is good. They're going to feel appreciated and they're going to have that connection and they're going to be healthier. And so honestly, we need to be more available to them. That's what I believe.
What I will say is we need to stop stigmatizing that Latinos is a small population. As you guys saw by the census, we are growing and we're getting more blue in the map that I saw up there. We have really dark blues like Florida, Texas, California, but we're getting blue everywhere. And the power of that is huge in terms of everything, businesses, the medical industry, everything. So knowing that and knowing that Latinos is a huge force that we need to serve them, right? Just like we do for every other population. So I think that's a key component that we need to stop saying that and thinking of that way.
Absolutely.
I think we should invest in health literacy, in the resources to be able to bridge the access to the services that are currently available. Also keeping in mind that community needs assessments, if I haven't emphasized it enough today, is vital. But piggybacking off what the doctor said, in the community, boots on the ground, door to door, workplaces. It's incredible what outreach can do. Doors that were closed before can easily open, and easily is an understatement. It takes a lot of advocacy to be able to do that, but it's not impossible.
So as we wrap up the conversation today, we have a lot of great representation from community outreach programs and doctors and just different standpoints and so many different people here in the audience today. What stakeholders do you think need to be brought into this conversation that perhaps aren't at all or don't have as much of a presence as they should? Thinking back to the slides that we saw and some of what we talked about, right? Policymakers certainly are a group of people that should be more involved within reason. So who do you feel is not really active in the conversation as much as they could be that we should bring in?
I think it's going to sound weird that I say this, but I think immigration attorneys, because there's a lot of families we have with immigration issues that are scared, that may be here legally, but may be scared to access public services and public health services because of the public charge issue. That may think, well, that could affect my ability to apply for citizenship later down the road. And so I think immigration attorneys would be good to include in the conversation because I think they could be good in providing knowledge and information to their clients.
That's wonderful. Definitely something that I wouldn't have thought of, but absolutely, when we think about our communities and the people, right? They're getting a lot of guidance from their attorneys on how to navigate this, and it can be a very scary and intimidating process. So to better educate that group would be amazing. Anybody else have?
I would say policymakers, politicians. I mean, not that we need more here in Dade County. I think we're good. But in the other counties, right? In the other states, definitely today seeing that graph was an eye. I believe all of you noticed, right? That's an eye opener for all of us that we don't have that representation in other counties and in other states. So definitely that. And the other thing for me will be business owners. We need to have more Latino business in Wall Street, right? In other nationwide companies. So having that representation is really gonna make us shift into who we are and what are we building for the future America.
Absolutely. I think employer-sponsored healthcare is the way in which the majority of the US population has access to healthcare. So making sure that business owners are equipped to provide their employees with this. So having not just the representation within businesses in corporate America, but we'll have a conversation about that, but making sure that we are in positions of power to be able to advocate for our community and advocate for those areas that are important to our population, right? Hispanics, very family oriented, and sometimes this is lost on some of our counterparts. Anybody else?
One other group I think is city planners. So that obviously overlaps with politics, but structuring our cities so that people can get healthy food. They have good access to transportation to get to the healthcare system. There's good education, even not depending on what neighborhood you happen to live in. And so having those opportunities, and that obviously we have a housing crisis in Miami-Dade, so we see some of the downsides to that. And so I think city planners have to be very much involved as well.
I'm thinking sponsors, funders that can help support the work in the field.
I think as a provider, it's important that we take the information to them, give them educational talks in a language that they can understand in a way that it resonates with them. And I think that would help. They have more information, it arms them so that they're able to take better care of themselves and their family.
Great. So as we wrap up the conversation here now, just to recap, right, we heard this is a growing population. We need to help each other. We need to be there for one another. We need to make sure that we are meeting people where they are. We remove stigma and barriers. We have, translation services and communication plans, and we bring in more people to the conversation that are really going to be able to help us move forward and really elevate health and wellness within the Hispanic community. So I want to thank you ladies for your contributions and conversation today, and everyone for joining us.